Hey everybody! Welcome to the ultimate pre-baby checklist, your go-to guide for getting ready to meet your little one. Whether you're a first-time parent or adding another bundle of joy to your family, this video is here to help you feel confident and prepared for the big day. Let's be real, you're probably feeling a mix of emotions right now. Maybe you're exhausted from sleepless nights. Maybe you're a little terrified about what's to come. But above all, you're excited to finally meet that tiny human who's been using your bladder as a trampoline for the past 9 months. It's a wild ride, but you're almost at the finish line. You've been counting down the days, marking your calendar, and watching your belly grow. Now the big day is almost here. Labor is the grand finale of pregnancy, the moment you've been waiting for and maybe even dreading just a little. But don't worry, you're not alone. We're here to help you get ready, step by step. Today, we're going through a checklist of 10 essential things you can do to feel prepared, organized, and maybe even a little bit excited for labor. From practical tips to emotional support, we've got you covered. Think of this as your roadmap to a smoother, less stressful experience. This checklist is packed with practical advice, helpful reminders, and, of course, a few laughs. Because let's face it, laughter really is the best medicine, especially when you're facing something as big as childbirth. We'll help you find the humor in the chaos and remind you that you've got this. We'll cover everything from packing your hospital bag with all the must-haves, to knowing the signs that it's finally go time, to making sure your support system is ready to cheer you on. We'll even talk about how to keep calm and stay positive as you head into labor. So stick around, and don't forget to subscribe for more helpful tips, encouragement, and a little bit of fun as you prepare for one of life's biggest adventures. Let's dive in. First things first, let's talk about packing your hospital bag. This might seem like a simple task, but trust me, it's one of the most important things you can do to prepare for your big day. Having your gear ready ahead of time means you can focus on what really matters when the moment arrives, welcoming your new baby into the world, not scrambling to find your favorite socks or phone charger at the last minute. Now is the time to channel your inner Mary Poppins, because we're about to fit a whole lot of essentials into one bag. Think of your hospital bag as your personal survival kit for labor, delivery, and those first precious hours with your newborn. It's amazing how much comfort a well-packed bag can bring, especially when you're away from home and everything feels new and a little overwhelming. First up, comfy clothes. Think soft, loose-fitting, and definitely not your pre-pregnancy jeans. You'll want outfits that make you feel relaxed and cozy, whether you're pacing the halls or snuggling your baby for the first time. Pack a couple of options: a nightgown or two, a robe, and some warm socks. Hospitals can be chilly, and you'll appreciate having layers to keep you comfortable. You've earned the right to rock those stretchy pants. In fact, stretchy pants and oversized shirts are practically the official uniform of new moms everywhere. Don't forget a going-home outfit that's easy to slip on and gentle on your body. You'll want something that feels like a hug after all your hard work. Next, don't forget your toiletries. Think toothbrush, toothpaste, shampoo, conditioner, deodorant, face wipes, and maybe even a little moisturizer or lip balm. Hospital air can be dry, and a few familiar comforts from home can make a world of difference. If you have a favorite scent or lotion, bring it along to help you feel refreshed and a bit more like yourself. Embrace the messy bun. It's practically a badge of honor in those early days. Hair ties, headbands, and dry shampoo can be lifesavers when you want to freshen up quickly. You might not have time for a full beauty routine, but a quick fix can help you feel put together for those first family photos. Now, let's talk entertainment. Pack your phone, charger, and maybe a good book or magazine. Labor can be unpredictable, and there may be stretches of downtime where you'll want something to distract or relax you. Consider downloading your favorite playlist, podcasts, or meditation apps ahead of time. And don't forget a long charging cable. Hospital outlets are often in awkward places. But honestly, the most entertaining thing in the room will be that little bundle of joy you're about to meet. Still, having a few comforts from home can help pass the time and keep your spirits up while you wait for your baby's arrival. And last but not least, snacks. This is crucial. Hospital food can be hit or miss, and you never know when hunger will strike, especially in the middle of the night. Pack a variety of snacks, some healthy, some indulgent, and all of them easy to eat one-handed. Think granola bars, trail mix, crackers, dried fruit, or even a little chocolate for a treat. Labor is a marathon, not a sprint, and you're going to need all the fuel you can get. Having your favorite snacks on hand can make those long hours more bearable. And they're great for sharing with your partner or support person too. You never know when those late-night cravings will hit, and you don't want to be stuck with hospital jello. Trust me, a stash of your favorite treats can be a real lifesaver when you need a little pick-me-up or something familiar to munch on. So pack your favorites: granola bars, crackers, fruit, whatever your heart desires. Don't forget a reusable water bottle to stay hydrated, and maybe a few mints or gum for a quick refresh. Trust me, you'll thank yourself later. A well-packed hospital bag is more than just a collection of things. It's your comfort zone, your little piece of home, and your secret weapon for making your hospital stay as smooth and stress-free as possible. So take your time, double-check your list, and get your gear ready. You've got this. Okay, so you've got your hospital bag packed and ready to go. Maybe you've double-checked your list, tucked in your favorite robe, and even added a few snacks for good measure. It's a big step, and it means you're getting closer to meeting your baby. But as the big day approaches, it's natural to wonder, how will I know when labor is actually starting? Let's talk about those early signs of labor so you can feel confident and prepared. Every pregnancy is unique, and labor can begin in different ways for different people. Sometimes the signs are subtle, and other times they're unmistakable. Knowing what to look for can help you stay calm and ready. First up, the infamous water breaking. You might picture a dramatic movie moment, but in reality, it's often much less theatrical. For some, it's a sudden gush of fluid, but for many, it's just a slow trickle that can be easy to miss. The fluid is usually clear or pale, and it doesn't have a strong smell. If you're unsure, put on a pad and monitor the flow. If it continues, it's likely your water has broken. Next, let's talk about contractions. Early contractions can feel a lot like period cramps or a dull ache in your lower back. At first, they might be irregular and mild, coming and going without a clear pattern. You might even wonder if it's just Braxton Hicks, those practice contractions you felt before. But as labor progresses, real contractions become stronger, longer, and more regular. As you get closer to active labor, you'll notice contractions picking up in intensity and coming at regular intervals. A good rule of thumb is the 5-1-1 rule: contractions every 5 minutes, lasting 1 minute each for at least 1 hour. That's a sign it's time to call your healthcare provider or head to the hospital. Another sign to watch for is the loss of your mucus plug. This is a thick, jelly-like discharge that can be clear, pink, or slightly bloody. It's your body's way of signaling that your cervix is starting to open up. Sometimes it comes out all at once, and other times it's a gradual process over several days. Some women also experience digestive changes like diarrhea or nausea in the days or hours leading up to labor. It might feel inconvenient, but it's actually your body's way of clearing out the system and getting ready for birth. You might also feel a sudden burst of energy, known as the nesting instinct, or on the flip side, extra fatigue. Remember, everybody is different. Some people experience all these signs while others only notice a few. The key is to pay attention to what feels different for you. Stay hydrated, rest when you can, and keep your support system close. All of this can sound overwhelming, but the most important thing is to listen to them. Trust your instincts. You know yourself better than anyone. If you feel anxious or unsure, take a few deep breaths and remind yourself that you're prepared for this moment. If something feels off, not sure, there is first signs of just All right, let's talk contractions. We're talking about those powerful squeezes your uterus is famous for. Imagine doing a really intense workout with your core. Every woman experiences contractions differently. Some say intense period cramps, others feel tightening or pressure in their lower abdomen. For some, it's all in the back. No matter how you experience them, contractions mean your body is doing exactly what it's supposed to do. It's bringing your baby closer to you. So, when you feel a contraction, take a deep breath. You're one step closer to meeting your little one. You're amazing, Mama. Let's talk about those pesky false alarms. Braxton Hicks contractions or practice contractions are totally normal during pregnancy. They're your body's way of warming up for the main event. Braxton Hicks usually come and go, and don't get stronger or closer together over time. Real labor contractions are more intense and regular. They'll get stronger and closer together no matter what you do. If you're ever unsure, don't hesitate to call your doctor. They'd rather you check in than worry. This is it. It's go time. But before you grab your hospital bag, let's talk about when it's actually time to head in. You don't want to arrive too early and end up doing laps around the maternity ward. A good rule of thumb, wait until your contractions are about 5 minutes apart, lasting a minute each for at least an hour, the 5-1-1 rule. Every labor is different, so check with your doctor for personalized advice. If you can time your contractions between cat videos, you're probably good to go. Let's get serious for a minute. While most pregnancies are normal, there are a few red flags to watch for. If you experience heavy bleeding, a sudden severe headache, fever over 100.4 degrees Fahrenheit, decreased baby movement, or pain during urination, call your doctor immediately. These could be signs of serious complications. It's always better to be safe than sorry. Don't hesitate to reach out if you have concerns. Now let's talk about inducing labor. Sometimes it's the best course of action for you and your baby. Your doctor might recommend induction if you're past your due date or have a medical condition like preeclampsia or gestational diabetes. It's a safe and common procedure. Think of it as giving your baby a gentle nudge when it's time to move out. Soon, you'll finally get some sleep. Let's be real. Labor is intense, but there are plenty of pain relief options. One of the most common is an epidural, which numbs the lower half of your body. Yes, it involves a needle, but the relief is worth it. There are also options like nitrous oxide, pain medications, and relaxation techniques. Talk to your doctor or midwife to create a birth plan that fits your wishes. You have choices. Find what works for you. Speaking of birth plans, let's talk about why they matter. A birth plan is simply a way to communicate your preferences to your healthcare team. It's a roadmap, but be ready to go with the flow. Babies don't always follow the plan. The most important thing is that you and your baby are safe and healthy. Flexibility is key. Labor and delivery can be overwhelming, but you're not alone. You have a team, your partner, doctor or midwife, nurses, family, and friends, all there to support you. Don't be afraid to lean on them for help, both physically and emotionally. Whether you need a hand to hold or a pep talk, your team is there for you. Take a deep breath, mama, you got this. There you have it. 10 things to do before labor to help you feel prepared and empowered. Trust your body, listen to your instincts, and ask for help when you need it. You've got a whole team rooting for you every step of the way. Soon you'll be holding your little one in your arms. Don't forget to subscribe and maybe pack an extra snack.